Howdy, howdy. This is Liz, and the reason why I'm making this video is because I received an email today from my mom's nursing home in Milledgeville, St. John, the Shannex. And so I received a series of paperwork for a vaccination consent. And so I found the paperwork and even the process of even questioning what's going on with the vaccines quite elusive and mysterious. So if I'm feeling that way, because I'm investigating a lot, I thought that probably a lot of people were feeling the same way. So I thought I'd make this video and just give you some information that you should consider before you even think about signing to any sort of consent form for your elderly loved one to have a vaccine, because that's what's coming soon. So if you would like to focus in on the papers now. I was given a few different information sheets, one or two, in the email that I received from the nursing home. So one was the aftercare sheet of the vaccine. One was a vaccine information sheet. One was a permission slip, but more than permission, but in there is actually a consent section. And also a little FAQ paper that is here that's been marked up by me. So when I'm looking at this form, it does say that it's to be filled out by the person that is administering the vaccine. And this is all data that's collected on your loved one prior to getting the vaccination. And then over here, there's just a couple questions about pre-existing conditions. And here it does read, sorry, Terra. It says, I have read or had explained to me the information on the COVID-19 vaccine and understand the risks, benefits, contraindications, and side effects. I give consent for myself, my child being immunized against COVID-19. I am aware that my child will have to wait 15 to 30 minutes following injection. So they want your permission. They want you to sign off on getting the vaccine. But I have had prior dealings with informed consent matters. And the problem that I have with this particular information packet is that the information on the COVID vaccine is very compartmentalized, packaged up in a way that makes it very small in size and tells you the most common things that you need to know. But unfortunately, they always leave out the really important details. So one of the really important details is what is known as the product monograph. This is a document that's available online, which I have provided a link to. And for every single, be it vaccination or any other type of pharmaceutical product, there's always a product monograph. It's like an advisory of certain things relative to the medication. So this is standard format for vaccinations, and it compares to other ones that I've seen of this variety. So there was a few details that I wanted to point out in this document, and I'm going to try to go through it pretty quickly. If you're curious at all, you probably should take a look at this. It's available, like I said, online. You can print it. So some things that I just took note of here is that the first thing that shocks me about this is that the safety and efficacy of this vaccine in children under 16 years of age have not yet been established. So it's very clear through this document that it's not for children. But it does also make it very clear that this is for geriatric patients. This is what it's being touted for, the most useful for. So it is noteworthy that this vaccine needs to be combined with 0.9% sodium chloride before it becomes in a consumable format. And then this section 7 starts with precautions. That it said that, as with all injectable vaccines, appropriate medical treatment and supervision should always be readily available in case of rare anaphylactic event following the administration. That's a pretty standard thing with a vaccine as well. As with any vaccine, vaccination may not protect all recipients. And so they have to put that in because there's no guarantee that you're going to become protected against the disease it's intended to be protecting you from. It's not a guarantee ever, which is known as well. Individuals may not be optimally protected until at least 7 days after their second dose of vaccine. So they expect this to be a 2-dose deal. And this is an important point for the immunocompromised persons, including individuals receiving immunosuppressant therapy, may have diminished immune response to the vaccine. So while that's not a safety warning, it sounds pretty much like it probably won't be effective for these individuals. And also, like, for example, someone like my mom who's on dialysis, she would essentially be, running that through the dialysis machine, and it doesn't really make a whole lot of sense. So, yes, that's moving on. Pregnant women, it's never been tested, never been established. The safety and efficacy in pregnant women have not yet been established. And this is really funny that this is being said in this document, because I know, for example, in the United States, they are vaccinating pregnant people. So pediatrics, again, it's not recommended for anyone under the age of 16. And clinical studies of this vaccine include participants 65 years of age and older. And their data contributes to the overall assessment of safety and efficacy. So what you need to understand about this is they're saying that these participants, the geriatric patients, namely the ones in our parents' nursing homes, they will actually become part of the study. And it will elaborate on that further on. So it's talking about the overview of adverse events. And I noticed a typical downplay of the really adverse serious events. They usually give you just a rundown of, the common things that happen, like injection site reaction, redness, swelling, maybe fever, things like that. It tells about studies. So without getting in too deep about how pharmaceutical industries do studies, there is a standard of studies that should be done before approval of pharmaceuticals is happening. And that is usually a double-blind inert placebo study, which means that the people receiving the placebo have no idea that they're receiving it. Then it's a inert placebo, meaning that it is nothing, like it's saline essentially, or sugar, whatever. So it talks about the studies here. The safety evaluation of participants in study 2 is still ongoing. Participants were monitored and for solicited local and systemic events and use of blah, blah, blah. Participants continued to be monitored for unsolicited adverse events, including serious adverse events up to 6 months after the last vaccine dose. So they're saying that the study is still ongoing and will be up to 6 months after your loved one receives the vaccine. It talks about adverse reactions. The adverse reaction rates observed in the clinical trials, therefore, may not reflect the rates observed in practice and should not be compared to the rates in the clinical trials of another drug. Okay, this talks about the results of the study data that was collected in study 2. It says that these were all reactions that were collected within 7 days of administration of the vaccine, which, I mean, if any of you know, vaccines have, lasting effects for years sometimes. So to suggest that 7 days is, adequate results that would mean actually anything to an actual human being is kind of insulting. But anyways, they do list the reactions after 7 days. And these numbers are expressed in percentages. And you can see here that this is the vaccine column. This is the placebo column. This is the vaccine column, dose 2, and the placebo column. And it says here that any local reaction, 83.6% of people in the study had this happen when they had the vaccine, the placebo, and then the second dose. So 83.6 is quite high. Yes. But it doesn't really mean a whole lot because 7 days is nothing. Like 7 days is nothing. Some people have effects months later.
Years.
Yes. So there's not really anything noteworthy there because the numbers, they just play with the numbers to sort of like wipe out the stuff that would be relevant to things that you want to know. And they just give you a bunch of mumbo jumbo and not very interesting, except 83.6% is quite a few events to happen to people. Like 83% of people in the study experienced a local reaction. And here, this one, any systemic event, it was 67.1% of the vaccine recipients. And then we continue with the results here. And this one was 72%, and that was for local reaction, but that was for a specific age group, which was over 56 years of age. So this is, again, semi-geriatric patients. And I don't mean to tell anybody that they're old at 56 because, I'm getting there too. And so this study, this next one is relevant. You can see my notes here. This is relative to the older population because they're studying the older people. And there's all these lists of events, and any systemic event total is 49% of people who had the vaccine did have some kind of event. And you can see that they range in severity, and severe means requires intravenous hydration or prevents daily activity.
Okay, and comparable to the placebo, and do you want to explain that placebo?
Yeah. Oh, yes. Thank you so much for reminding me. So, I haven't been drawing attention to these numbers. When you first see this number, it looks kind of crazy. It says 37.9. So one would sort of say, geez, what are you even talking about? There's no problem here because the vaccine only gives people a little bit more problems than the placebo, right?
Which is nothing at all. It's what, sugar water or saline?
Yeah, exactly. So what is the placebo? And this is a really good point that this document explains how the research, the plan, the design of the study goes. Oh, look here, trial design and study demographics. But it doesn't mention at all, one single time in this whole document, what they use as a placebo. So that is really relevant. And the reason why it's relevant is because, if you're doing a study and you're comparing, ambrosia apples to, let's say, Macintosh, you would need to know that. So that would be a parameter of knowing in the study what the placebo is, because the results would vary and they would mean different things to you. If you, let's say you said, okay, this placebo was, let's say, another vaccine, because oftentimes, sorry, I'm getting loud, but oftentimes they do use other vaccines as the placebo in the study. So the data is only pointing out the differences in those reactions from one vaccine to another. They're not comparing one vaccine to the inert placebo, like water. They could do water, but they don't.
And with a second dose, it appears to me that we're seeing a spike. So it's going from 49 compared to a placebo, which is not inert, and you're getting your second dose here, and then your reactions are 64.5.
Yeah, and the second dose
So
of the vaccine.
That seems to be something pathogenic happening.
Yeah.
Like a priming because we're seeing that these numbers are going up. That would indicate there's something that's triggering that to occur.
Yes.
Okay.
And
Thank you
it's
for explaining.
Thank you. And it's worth noting here that like the numbers for the vaccinated in the test start out at 1802, and then the second dose there's 1660. And there's no explanation here as to why 140 people dropped off the vaccination train there for their clinical trial, just so you know.
And yet we're getting a higher number of reactions with less people compared
Yes.
to. So do you see that?
Yes,
Yeah.
it's a percentage. So you do want to look at those numbers. Like if you know anything about, like trading in the market, I'm trying to learn about it, but this I've been looking
Very
at for years.
comparable.
But yes, they do actually try to hide the facts in this, because we're all used to, you can't possibly know anything, Google University, like it's the worst thing ever. But I mean doctors can understand this, and it's undeniable. I'm sorry, it's just undeniable.
Anybody can understand
Right.
it if they take the initiative to understand.
Yes.
It's very.
Yeah, well, it's
right
all there in black and white.
Yeah.
You can't hide
It's
it.
the interpretation of it.
Yes.
So yeah, but those that can interpret it can share that knowledge with others, right?
Yes, okay, so this is a very important page, because it says here under unsolicited adverse events that no deaths related to the vaccine were reported in the study. So do you hear the language there? Because what I hear is no deaths related to the vaccine were reported in the study, but there were deaths, but there were none related to the vaccine.
And is this in a 7-day period that these deaths are occurring coincidentally?
Well, according to this, it says that they were recorded from dose 1 to 30 days
Okay.
after dose 2.
So there were deaths within 30 days of dose 2.
Well, it says no deaths, but it's
really,
hiding.
it says there's no deaths related to the vaccine,
Right.
but that in itself indicates there were deaths.
It does.
Okay.
Because they like to use words that they can get away with
Okay.
stuff.
Okay.
About like that.
And this
just
is
like that.
in a 30-day period.
Well, according to this, 30 days after dose 2, so that would
Yes.
be around 51 days, because they said
it's
to have
21 for each
in between.
dose. Yes,
Yeah.
good.
Okay, so non-serious events. I just made note of the fact that it said here lymphadenopathy had occurred, and there were no other notable
this is-
patterns of numerical
so-
imbalances
Okay.
between treatment groups for the specific categories or non-serious
This
adverse
is
events.
inflammation of your lymph node system.
Yes.
Yes.
Which
That
is a very
indicates
significant problem.
Because that is where your immune system is. Your lymphatic and your immune system are
Yes.
connected together. So this tells you it's triggering an autoimmune reaction.
Yeah, and here they sort of baffle you with bull crap here. They say there were no other notable patterns or numerical imbalances between treatment groups for specific categories of non-serious adverse events, including other neurologic or neuroinflammatory and thrombotic events that would suggest a causal relationship to the Pfizer BioNTech COVID vaccine.
So it tells you what's causing the problem right here in the
Yeah.
wording, and then it tells you what right here what it's doing.
Yeah, but they're saying
So
there's no causal relationship though.
But this is your immune system, and all these things are connected to your
Yeah.
central nervous system, which is all part of the
But they
whole
just want to
system
let
that
you
we are.
know it's not a causal relationship to it. We already know it exists, but it doesn't mean anything.
Yes, it's happening though,
Right.
but it's not. So is it happening in these individuals prior to the introduction of these substances, or is it just assumed that this is something that's normal? I'm sorry.
Yeah, I don't know. I don't know.
Clarity on that.
I think it's subject to a little bit of interpretation, really. It really is, depending on the reader, because I see all kinds of problems with this. But
Yes.
let's continue on here. Mechanism of action: the vaccine elicits both neutralizing antibody and cellular immune response to the spike antigen, which may contribute to protection against COVID disease. It seems like they are not really sure, right? Because, I mean, after all, it's still in the clinical studies. Like your person, when they fill out this form here, they're going to become part of the clinical study data. That's what's happening.
This is a consent form.
Yes, it is a consent form. Okay, so this is just about how they dilute it. It was had to be diluted with sodium, whatever. Not important right now. And it just says it's a highly purified single-stranded 5-capped messenger RNA produced using a cell-free in vitro transcription from the corresponding DNA templates encoding the viral spike protein of SARS-CoV-2. Sounds like a hypothesis to me.
Messenger RNA edits the RNA, which is what repairs our broken DNA. So they're telling it to go into our genetic code and insert itself.
Yeah, it's definitely playing with your genetics.
Yeah,
it certainly is.
That's concerning.
So the other thing I got from this sheet is like they still never said, because it's the trial design and study demographics, and they never said what placebo.
So
they mentioned the placebo several times, but never say what it is.
Yeah, and we've never used mRNA vaccine before.
No, this is the first time.
Okay, so this is what this consent is for, because
it's special.
They need to give their permission to be part of all of this, and it's telling you that this is a study, so you are part of an experimental group.
Yes, in signing this
is third
paper,
phase.
You are signing to your loved one, or you, or your child, or whatever, becoming part of the trial.
Okay. And was this contained with the paperwork that you... Okay.
No, it wasn't. It's separate, and I'm going to put a link to it in the email, and that's why we're talking about it, because it's not part of the process. And I just want to say that anybody who knows what consent means, like you consent. So what's consent? Well, I say to you, hey, Terra-Lynn, do you want to have a drink of rum tonight? And you say...
I'm going to pass.
Oh, well, if you say yes, right?
Oh,
if you
yes.
say yes,
I'm supposed to say
you're
yes.
consenting
I'm going to pass.
to the rum,
yes,
right?
That's right. But no, I am consenting. I'm giving my informed consent.
That's right.
And I'm saying I'm going to pass.
And the reason why you're passing is because you know that you want to drive out of here and you don't want to have any problems with the law.
I'm gonna have
or
problems.
killing somebody.
I'm going to have problems with this if I'm subjected. And I'm not going to be pulling out of anywhere. That's a problem.
Well,
for
what
me.
I'm saying to you about consent, I was just using a very, very typical example of you consenting to something.
So I haven't signed these papers yet, right?
I'm just talking about drinking.
Okay.
The reason why you didn't accept the drink is because you know the consequences of the drink.
That's right.
And so you can decide for yourself.
That's right.
That was the whole point.
Consent. Yes,
So you cannot give consent if you don't understand the consequences. That's why children aren't allowed to drink. Mm-hmm. Okay? So children cannot consent to themselves getting a vaccine.
Or drink it. Wait, so 16, but they can't drink until they're 19 in Canada?
Yeah.
Or is it 18?
In some provinces, it's a different age. But nonetheless, let's continue on with this statement here. You can't analyze the results from two separate groups of people who received two separate products without knowing what each group got. Like, I'm back to the placebo again, because nowhere here it doesn't say what they used as an actual placebo. Like, did they use water? Did they use vinegar? Did they use saline? Did they use sodium chloride? Did they use another vaccine? Because that's common. What did they use? Doesn't say. Doesn't say.
In other cases, it has all been compared to another vaccine in all prior vaccine trials.
The ones that I've seen, the prior vaccine trials, they always compare one vaccine to another, because they say it's unethical to do it any other way.
Yeah, that seems odd.
Yes. Okay. So we're really long here. So let's try to speed it up. So, anyways, general toxicology has not been. No clinical data reveal. Non-clinical data reveal no special hazard for humans based on conventional studies of repeat dose toxicity, which doesn't mean anything. Nothing. They're just giving you lip service. Carcinogenic potential was not assessed. Genotoxic potential was not assessed. And look at this little tiny line up here, which is the most important one. And if I didn't print this double-sided, I could have actually left this whole page out and probably got away with it, except if you really paid attention to the numbers on the bottom of the page. But anyway, it says reproduction and developmental toxicology studies in animals have not been completed.
No studies in animals have been completed.
Right.
Correct?
No studies.
So why are we pointing out that these things haven't been studied in animals when we know nothing in animals? So what does it have to do with these two things that might indicate there's an issue?
Well, I think that they might be trying to hide this little bit of
information, but they're giving it to us right there.
Yeah, it's
okay.
It is very sneaky what they're doing there.
Yes.
But nobody cares about that in the old people, because they're not trying to reproduce.
Because it's in there. So this is all legal. This is well, you're entering into a contract.
Yes, you are. You are. So but they don't even give you this. This is like, you have to go out and find this on your own.
Legalese.
Yes.
Legalese, yeah.
Okay, so this here, it just says that Health Canada has authorized the sale of the COVID vaccine under an interim order. It even says it in the product monograph. And the interim order is like, catch all, like, we're going to do this. We're going to get this ramrodded right in there real quick, and we're doing it with an interim order. This leaflet is a summary and will not tell you everything about the vaccine. Talk to your healthcare professional about the medical condition, treatment, and ask if there is any new information about the vaccine. And it's not for anybody who's 16 years of age or younger. That kids don't get this vaccine.
So anyone under 16?
No one. It says can be given to people from 16 and older.
Okay.
So this is a
because
wow.
That's the age of consent, correct?
Well, I would say that it's multi-purpose, yes, because it's complicated to get consent for children because their parents need to do that. But for instance, they could be asking children in high school as a result of this to get that vaccine.
And they're
FYI.
They're afraid and whatnot, so they're more likely to make an impulsive decision instead of discussing it with their loved ones. Yeah,
because they're told that it's the best thing for them. So what is the wow factor here? How does the vaccine work? So this verbiage, again, it's somebody who's like, I don't know, creative, I guess, with this words. But the vaccine uses a new method, messenger RNA, mRNA, the genetic code for a piece of the virus, to help our bodies make protection against the virus. To help our bodies make protection against the virus.
That they've introduced.
Yes, because I mean, the process by which this happens is much too complicated for the mere human being to understand.
So mRNA,
just realize
that virus. So that mRNA and that piece of the virus, it's going to insert itself into your genetic code to correct not getting the virus?
Well, I mean, I don't know how you could call it correcting, because
Well,
anything that
I'm
changes
sorry,
the code is definitely not correcting it.
Sorry, protecting.
It's
Wrong word.
destroying it.
Your body is protecting itself from this virus that they've introduced. It
Yes.
not only introduced, they've inserted it into your mRNA, which rebuilds your DNA. So
Yes.
it's modifying.
Yeah, it's kind of
So they're
complicated.
putting viruses into your central nervous system.
So, as with any vaccine,
Lovely. That can't turn out well.
may not fully protect all of those who receive it. Even after you've had both doses, continue to follow the recommendations of local public health officials to prevent the spread. So it's even saying in the
not
product
gonna
monograph that
protect you.
we're still going to mask you.
Yeah, it's not going to.
We're still going to have to, not going to be able to travel. You're not going to be able to do anything.
So this is very unsure. It's telling, we don't know what this is going to do to you.
And this is unprecedented, because the product monograph does never mesh the demands or the requirements of public health. It doesn't ever do that.
See, they tell you it can do this, but then this line here by itself is telling you what it just told you it could do. It's telling you now it cannot do. That's some crafty wording right there.
Yeah, it is. Okay, moving on. The ingredients. I mean, I tried to read these earlier and we kind of laughed about it, because it says hydroxybutyl and zenadidyl hexane hexaldecanoate polyethylene glycol. Hey, that's a good one. I think that's antifreeze. Polyethylene glycol.
PEG. It's what's it? PEG.
Yeah. Just say click close. Okay, moving on. Can't read those ingredients. Don't know what they are, but they sound yummy. I did put yummy there. See, yummy. I would eat them for sure.
Oh, yes. I don't even know what they are, aside from the PEG, because I know that I've used it on burns and stuff before.
How would you know if you should not receive the COVID vaccine? If you are allergic to any of the ingredients in this vaccine, I mean, how would you know if you were allergic to
any of these things?
polyethylene glycol? How would you know?
Well,
right?
They're using it as an antigen to trigger the immune system.
And
yeah.
If you have any symptoms of COVID, you should not take the vaccine. That's what it says here.
Well, how do you know if you have symptoms of COVID if you're asymptomatic and
Well,
are showing
there's
no
not
symptoms?
symptoms. There's not symptoms then.
Well, then maybe we shouldn't take it if we're asymptomatic.
How would we know if we're asymptomatic?
It's telling us not to. So, if there's no symptoms of having it, then we can assume we have it because we have no symptoms. So we don't need to take it. Oh, this is only a study. So this right now at this point is not mandatory. Okay, moving on. I'll let you get back to that.
Okay. Well,
That's
we're going to try to
crafty.
finish up
Yeah.
because we're, oh my goodness, 32. Wow, that's
a
crazy.
lot of papers. Look how
It
many
is a
papers
lot.
we
It
got.
is a lot. I'm doing
So
a
how
longer
many
job than I
pages is
planned
this?
on
We're
doing.
almost through it.
Yes, we are.
Awesome.
It's just who should
Moving
not
on.
take the vaccine is what it's talking about
Okay.
there. So these are not all the possible side effects that you may have when taking this vaccine. If you experience any side effects not listed here, tell your healthcare professional. So they give you a couple of examples. And if you experience a severe allergic reaction, call 911. And so then it tells you how to report an adverse event. And right here it says, if you want more information, for the full product monograph that is prepared for healthcare professionals and includes the patient medication information by visiting the Health Canada website, find the full product monograph. So this is not a full product monograph, and it is 26 pages long. But they're saying for a full product monograph that has all the information, including all the adverse events, go to this website. So I went to that website, and that's why I put here dead link 404 error not found, because that's what it said.
Okay, so it was apparently revised December 9th at the last time.
Yeah.
But we haven't rolled any of this out yet because we're not into. Oh no, we are undergoing phase 3.
Okay.
This is the phase 3, right?
So there is
Yes.
nowhere's, like, this is a dead link, and there is no complete list of side effects. That's why I wrote this,
Okay.
because if you didn't get anything from the last 4 minutes that I've been talking, is that there is no complete list of side effects available for this vaccine.
And it's not been
In
updated
print.
since December 9th.
And this link is dead. It doesn't do anything. It doesn't go
And
anywhere.
they've been given the vaccine, but they've not been logging side effects.
Well, we wouldn't know. They're definitely, we can't say that, but this isn't the side effect. This is about the side effects up here.
So they are logging side effects, but they're not telling us about it.
No, this is about yeah.
Yes.
The ones that already exist, like when they said that.
Because this only goes to December 9th. Okay, thank you very much.
Okay. So the other thing I wanted to point out here, before we go, it's so long and winded, is that this is an email from the, she has a PhD, and she works at the George Dumont, and I believe that she works in the laboratory, C, Vitality, NB, and she's saying 45 amplification cycles are performed. It is the norm in Canada, public health laboratories, and around the world. So what is that? It's a PCR test.
At 45 amplification?
Yeah, this is what New Brunswick is doing the
Okay.
tests at.
So with the PCR, we know that if it's run over, what, more than 25 amplifications?
Well, I'm going to get to that right here.
Okay.
Okay, so here's the Corman
Oh,
Drosten
35.
review. So the Corman Drosten review is right here. This is the website where you can look at it. There's actual scientists who looked at the PCR test. You got to get this little report.
Yeah, I
thing
got
there.
it right there.
Okay. The number of amplification cycles, less than 35, preferably 25 to 30. In case of virus detection, less than 35 cycles, more than 35 cycles, only detect signals which do not correlate with infectious virus, as determined by isolation in cell culture reviewed in number 2. If someone is tested by PCR test as positive when a threshold of 35 cycles or higher is used, as is the case in most laboratories in Europe and US, the probability that said person is actually infected is less than 3%. The probability that said result is false positive is 97%. And I just told you here
So these
that
are all
we're
based
using
upon false positive PCR tests?
45 amplification cycles, and the
and-
Corman Drosten review says that anything over 35 detects signals which do not correlate with infectious virus.
Yeah. So really less than 35, preferably 25, but they're saying really you shouldn't do more than 25 cycles or you're going to run a 97% of having a false positive.
Yeah, and there's the website, and you can look at it yourself. Scientists reviewed it. So this whole case demic is been created by PCR tests that give irrational, irrelevant, and irresponsible results. And this is my phone number, and this is my email, and it's a wrap.